You can think of the cortex as this sheet of paper here. Now, we want to fit a large area into a small volume, so what's actually happening is that we have to fold the sheet of paper like this, and this is actually what's also happening in the brain. My name is Wachinger, and I'm a professor for AI in radiology at the Technical University of Munich, and I'm also associated with the MCML. The cortex is a sheet of neural tissue that has two boundaries. On the inside, we have the white matter surface, and on the outside, we have the PL surface. Now, if we have both of those surfaces reconstructed, what we can do now is we can measure the thickness of the cortex that is shown by these arrows here. One of the challenges is that a typical cortical thickness of a person is between 2 to 3 millimeters. If you have patients that are suffering from, for instance, dementia, the cortex is shrinking. So what is happening here is that some of the neural tissue is lost. So for instance, this would be now the surface for a deceased subject. You can see that this is resulting in a lower thickness. The resolution of these images is just about 1 millimeters. So 1 pixel of the image would be about this size. So you can imagine when we have to manually try to assess the thickness of the cortex, this is a very challenging task. Further, you have to keep in mind this is actually a 3D structure, and this is just now here a 2D slice. So this is one of the motivations why we're interested in having these automated reconstruction of the cortex, so that we can have access to these measurements in very high precision. AI systems, or deep neural networks particularly, they are black boxes. So we do not know exactly what is actually happening. How do they come up with these decisions? The type of explanations that we will develop are based on case-based reasoning. Imagine the following scenario. You're given an image that you have acquired of a bird, and you do not know the species that is shown in the picture. At the same time, you're given a large collection of images of known bird species. Now, what the algorithm is doing, it is learning characteristic features about each of these species. For instance, this one here may have a very short peak, and this one here may have characteristic patterns on the feathers, for instance. When it comes to this new picture, what the algorithm is trying to do now is trying to find these characteristic patterns that we have seen in the training images in the current image. So for instance, in these three, maybe it sees this specific short peak also in this picture here. So it will come up as a decision that the type of species that is actually shown in this picture is the first one in this case. Now what we are trying to do is to use the same technique also on medical images. Imagine that we are giving now here a brain scan. And this is the current brain scan of a subject for which we do not know if this subject is suffering from a certain disease. Similarly to the bird example, we now have here a training set of different brains from a large collection of subjects. And again, the algorithm here learns maybe specific patterns. For instance, here there may be thinning in this region in the brain, or here, for instance, in the temporal lobe, or for instance, here in the parietal lobe. And now for the current test subject, it is now trying to identify which one of those is actually best matching. So for instance, here we may have this pattern in temporal lobe also in the current test image, and this would then give a justification as to why the decision for a specific type of dementia is made by the algorithm.
Is there anything you would like to add?
I'm a bad bird drawer.